All right, so it's 4:32. I think we're going to go ahead and call the meeting to order. So thank you to everybody who has joined us thus far. My name is Jesse Letterman. I'm chairman of the City Council's COVID-19 Response Committee, and we are joined here for our weekly Zoom meeting by the president of the City Council, Marcus Williams. We are also joined by City Councilor Malo Brown from Ward 4, City Councilor Michael Fenton from Ward 2, and we are also joined by members of our state delegation. We have Representative Oliveira with us. We also have Representative Brian Ash, and we, as we mentioned earlier, we're joined by Alda Coelho from Representative Pupilo's office, and I see a couple of other folks on the call. If you want to just share who you're here representing, and again, I also know we're going to be joined by Senator Gomez briefly. So I see Ali R.
Yeah, my name's Ali. I'm the district aide for Senator Gomez, so I'll be here on his behalf.
Great, and then I see Gia Varlotto.
Hi, everyone. My name is Gia Varlotto. I am here from Rep. Pupilo's office.
Great. And I know we had City Councilor Tim Allen just joined the call as well. And let's see, who else do we have here? I know we have Joel McCullough from Senator Lesser's office, and who else has not been identified yet? I see Mike from Rep. Finn's office. I don't know if that's you, Rep. Finn, or who that is, but it does look like Rep. Finn may be represented here in some way. Or yes, hi, Mike. Introduce yourself.
Hello, my name is Michael Flam. I work for Representative Finn. I'm a staff director, and I'm sitting in on the meeting on his behalf today. Good to see everybody.
Thanks so much, Mike. And Senator Lesser's joined us as well. So we're going to go ahead and get started. We're also joined by our friend Jay Latore, a member of the public. Jay, thank you for jumping on the call and utilizing the new system that the president has established for public participation. We appreciate that. And so we'll start with our health commissioner, Commissioner Helen Calton Harris, for our weekly briefing. I know she presented some great information yesterday with the mayor, but we would appreciate a recap, and then we'll go from there. Commissioner, the floor is yours.
Thank you very much, and good evening to everyone. It has, for all of us, probably been a very long day. We in the city of Springfield held our second dose of COVID-19 vaccination at Boland School today. We vaccinated over 250 individuals for their second dose. That clinic went extremely well. We will be doing that clinic all week this week, and we will also be doing it Thursday and Friday of next week. Again, the clinic is only for individuals who have received their first dose from the Department of Health and Human Services. So it went extremely well. First of all, let me start by thanking Council President Williams for establishing this very important subcommittee. It's very important to the city of Springfield, and certainly to all of our residents. And of course, to your chair, Councilor Letterman, thank you so much for your diligence on behalf of Health and Human Services. So as Councilor Letterman said, I did give an update with Mayor Sarno yesterday. I will do that in a brief format. I will also just update around VaxForce, the vaccination effort committee that we have put together in the city of Springfield, who met today as well. And so let me start with the data. The data is looking better. As we continue to say, we want to do as best we can. So we continue to see our numbers go down. And we had a high of 1,177 cases. That was the week of January the 3rd. The next week, that went down 134 cases. That was the week of January 10th. That following week, the week of January 17th, it went down 91 cases. And then the week of January 24th, it decreased by 41 cases. Last week, it decreased by 273 cases. which was the most significant decrease that we have had in the city in some time. So that is good news for us. Also, for the month of January, there were 4,342 cases total in the city, which was 154 cases less than we had in the previous month of December. So again, not a significant decrease, but a decrease nevertheless. We are looking forward to continued decreases. There is additional information as far as the data is concerned. You will find it on the city's website, but I'm going to just give a couple of other data points. Again, if you'd like to see the data in total, please go to the website of the city of Springfield. Last week, we saw 75% of our cases were under the age of 50. 44% of those cases were under the age of 30. What we are seeing that's a little bit different is an increase in the higher education numbers that we're seeing. There are students going back onto the college campuses, and we are seeing certainly a slight increase in those numbers, but nothing that has really been overwhelming, but we are tracking the trends. We also have seen cases, clusters in residential houses, and we are following those extremely closely. Again, those clusters are not significant enough to really skew the data significantly, but it is significant enough that we in the department need to work with our local partners to make sure that we're paying attention. As far as ages are concerned, 55 cases last week were between 0 and 10. And the most significant, I think, increase was 21 to 30, where we saw 127 cases, 41 to 50, 103 cases, and then the 61 to 70-year-old, 140 cases, 71 to 80, 27 cases. Again, this data is on our website. I invite you to take a look at it. I'm going to just end with the zip codes. 01101 had 3 cases, which was 0% of our cases. 01103 had 4 cases, 1%. 04 had 120 cases, which is 19%. And then 05, 65 cases, 68 cases, 10%. 07, 56 cases, 7%. 08, 94 cases, 15%. 09, 157 cases, which was 24%. 18 had 35 cases, 5%. 19, 62 cases, 10%. 28, 11 cases, 2%. 29, 14 cases, 2%. And then 51 had 19 cases at 3%. What we are seeing is 01109, and I want you to remember that in 010, we had several institutions of higher learning. We did see a 4% increase in 09, and I believe that slight increase has to do with the institutions of higher learning and the slight increase that we're seeing there. I will end with the race and ethnicities. Black African-American was 14% of the cases that we saw last week. Latinx was 24%, white was 32%. And we should say that we have an unknown category of 27%, where the testing documents are not picking up a race, either because a person does not give us a race or ethnicity, and usually that is the unknown category. Let me say we have stood up 3 new testings. We have new testing sites. Rebecca Johnson is now a testing site that is 1 day a week. Putnam is now a testing site that is 1 day a week. So our goal really, and we will be standing up another testing site in Indian Orchard in the following week. We are bringing closure to where we believe we can house that. And so you will hear that next week we had stood up a testing site in Indian Orchard. I should say our Elder Affairs Department, as well as our libraries, have done an amazing job of helping our residents navigate, as well as the Department of Health and Human Services, navigating our residents and registering them at Eastfield Mall. The Department of Elder Affairs took 612 calls and registered 426 individuals. The libraries registered 421 individuals, and Health and Human Services took 616 calls in 1 week. And so we responded with 1,649 to calls over the last week, and we're able to help Springfield residents register at the Eastfield Mall site. The VaxForce meeting was today. It was just a wonderful meeting, and we are moving towards a town hall that we will be hosting. It was, again, every major organization, healthcare institution in the Western region are a part of VaxForce and are extremely engaged. And we have, as you know, we have committees. The committees are a faith committee, an education committee, a healthcare committee, a DE&I, diversity, equity, inclusion committee. So those committees are working hard, and we will be having a town hall and establishing a white paper. AMR so far has tested 136,855, 12,921 positives. They have had enough Springfield residents. They have tested 58,331. Springfield Public Schools, we did 221 tests for coaches as well as students, for student athletes, and got 0 positives, which is excellent news. And I think that the Springfield School Department and DA Early and coaches should be very proud of the work that they've done in keeping our student athletes. And we're talking about basketball and we're talking about swimming. Those are the two sports that are moving forward. We are looking at spring sports and potentially thinking about can we do football and other sports, as well as thinking about schools and the school opening and the impact of that. So that pretty much is it. I did say that I believe that teachers are essential workers and should have been treated as such in the vaccination process. We want our children back in school, yet we are asking our teachers to take risks. Now, we know the data across the nation says that schools are not primary spreaders of the virus. But again, we want individuals who have to go into any setting to feel as though they are protected and comfortable. And psychological can be just as damaging as real data. And so we wanted to make the case that our teachers and our funeral directors should be priority populations as far as vaccinations are concerned. I did say also that Sunday was National Black HIV/AIDS Awareness Day. And that pretty much was a capsule of everything that I almost said yesterday. I'm happy to answer any questions that the council or our guests may have.
Thank you, Commissioner. And so if there's any questions for the Commissioner from the council, or if any of the representatives and senators before we move sort of fully over to you all while we have you here, it's a great opportunity. If you do have any questions for the Commissioner, if you just want to raise your hand in the queue is usually how we do it. And while we see if any hands get raised, Commissioner, I had a couple of questions for the Putnam site that's been stood up and the RBJ site. What are the days and hours for those? I know you said it was 1 day.
Absolutely. So both, it is Tuesday, 11 to 3 for both sites. And right now we're only doing 1 day a week. The new site that we set up in Indian Orchard will be on Wednesday. It will be the same time, 11 to 3.
Do we know, I know we were talking with New North about contracting for a site in the north end. Did that happen?
Yes, New North has stood up a site at Greek Cultural Center. AMR is doing that testing as well. They stood up the first site, first testing last Thursday. They will be there again this Thursday. Part of the challenge that is prevalent at this point is that they're having difficulty making sure that residents are aware. So New North is going door to door and doing outreach into the community, because last Thursday, they tell me there were only about 30 individuals who came and got tested. And so we wanted to make sure that we're doing targeted outreach, because it could just simply be that individuals don't know that it's there, and we need to do a better job of marketing. But I know that New North Citizens Council is taking the opportunity to reach out to the residents in the North End. And
Commissioner, at the end of last week, following our meeting last week with yourself, we did send a letter to the administration and the Secretary of HHS regarding, the need to move as quickly as possible towards the local vaccination sites that you've indicated are ready to be established, but doses are needed. And I'm glad that the state delegation is here to talk a little bit about that. We did receive a response from the governor's Western Mass office. We actually had invited them to attend this meeting. They indicated to us that they were unable to attend today. However, they were willing to meet with the committee and discuss the timeline and those pieces as well. So we're waiting to hear back from Mr. Delgado about when that will be. But Commissioner, I'm just wondering if you've had any other indication from the state about when they think they'll begin prioritizing doses to cities and towns for those types of distribution efforts. You mentioned teachers, funeral directors, things like that. So have we heard anything on the administration's end?
Counselor, there is the potential that the city of Springfield will receive doses to be able to give to city residents. It is not concrete yet. There are conversations that are currently happening. I do not have a final outcome at this point, but I do know that your letter, your outreach has made a difference, because it appears that the governor's office has heard us as far as needing additional vaccinations in cities and towns. And so I expect that over the next week, you will hear there has been movement there. I don't have concrete information right now, but I think your advocacy has made a difference.
Well, thank you, Commissioner. I mean, that's our goal, is just to amplify, whatever message we can in collaboration with the administration and with our state delegation, our colleagues. We did also ask in that letter for the data that you had mentioned relative to the Eastfield Mall to see, how many Springfield residents have actually been able to get access and what any demographic data that we may have on them. So I see President Williams' hand raised in the queue. Also, we're joined now by our friend, former colleague, Senator Gomez, continued colleague. So President Williams, we'll go over to you and then see if there's any other question. We'll move to the state delegation.
All right. Thank you, Mr. Chair. Well, first, I just want to thank the state delegation as well as those representatives and those standing in for representatives for being on the call today. I don't actually have a question. It's more a mere acknowledgement of course, Eastville Mall has been kind of in the headlines, considering that, seniors have had to wait in long lines and out in the cold to get vaccinated. And I did see the news directives that were put out today to help alleviate that concern as it related to deploying the National Guard, as well as making sure that those folks have an opportunity to wait inside to get vaccinated. And I actually, just sitting here, saw another press release where now the Springfield Police Department is being deployed because there are still some concerns. So I just wanted to offer just a thanks of gratitude. And I know you've been a part of those conversations to make sure that the facilities that actually are run by the state certainly have some kind of localized kind of input as well. So in that kind of thread, I think we should certainly continue working across the aisle with the state. And I'm just glad that folks from the state are actually on the call today to address some of those concerns as well. So just thank you across the board.
Commissioner, on that note, both the president and I spoke yesterday with management at the Eastfield Mall because when we had been there 2 weeks ago, it was a very different scene. And so we were very surprised to see how much it had broken down, seemingly. And the mall had indicated that, as the mayor's press release did, that individuals would, at the very least, if there were lines, which there hopefully shouldn't be very long lines, but if there were, that they'd be able to wait inside. I haven't been able to go over there today yet, but I'm wondering if anybody has been over there and if people are at least not being asked to wait outside in the cold. Does anybody know the status of that today?
I do not. I sent 2 staff members there. I can, after I get off of this call, I can check in with them to see what they were, what they found, because I do think it's important for us to monitor. You know, this city council, you all have been very, very concrete and very intentional about advocating for particularly the city of Springfield. Geographic disparity exists in the Commonwealth of Massachusetts. While we work, you say you work, well, I mean, we work across the aisle, but I do think it's important that we have to pay attention to the services that we get here, how they're rendered to our population, and just who is impacted. To your point, we don't have the data that tells us how many Springfield residents were there. You know, we are not, we've heard feedback. That's why I think you're going to hear some real movement around standing up sites in the city of Springfield because of the geographical disparity and the residents of our city being put on the back burner as far as access is concerned.
Well, I'm glad to hear that. So I see. So we'll try to find out exactly what happened over there today. I see Senator Gomez's hand is up, and I do think this is a good time to transition to the state delegation. But Senator, did you have a question for the commissioner?
Oh, no, it was just to add that one thing in respect is that Eastfield Mall is a site that is a regional site. It's not specific to Springfield.
That's right.
I think for us to laser focus on how many Springfield residents were there. And as much as I would like to know those statistics, outside of the company that was contracted and is taking those appointments, it's the only way we're really going to find out how many Springfield residents there. But there was a lot of people. I took a lot of phone calls, my staff, specific to what was going on. I know that Rep. Gonzalez was down there on the ground yesterday. You know, we definitely have different people have sent me a bunch of photos. You know, there was hundreds of people waiting outside. But one thing that we seen that was a problem in speaking to the representative, and also I've been in communication with Senator Lesser's office, is that, you know, there wasn't necessarily proper signage. You know, they were trying to mitigate and get people to stay in their cars. And obviously with the news, I think it caused a hysteria of saying that if they're not in line, maybe, because that's what we tell our people to stand in line, we might miss our chance to get this vaccination. And then just the day before, in 2 sites, they were turning people away because of the snowstorm. So logistically, honestly, I think it's been an upsetting situation. I know that I was in contact with the Western Massachusetts Director of Governor Baker, Jose Delgado. He let me know before the administration had press released that we are going to be getting some assistance from the National Guard on trying to mitigate and figure out what's going on with, Eastfield Mall. But granted, Eastfield Mall for a week straight had limited employees there. And honestly, on behest of the fact that, you know, we're transitioning into these phases, I think that folks weren't really, I think, prepared, honestly, to figure out what we were going to do. But I just want to add a little bit of that, you know, we're working hard. I know that it's not what we want to see, but realistically, I think it's important for us to, you know, stay adamant and figure out how the council is going to work with the delegation. I know that the delegation is having meetings with Secretary Sutters. I know the administration is doing a lot of different work as well, trying to figure out. But if we're not collectively working together on these issues, without knowledge of, you know, letters that are being sent out or communication with the administration, how can we work as a body and work together specifically to COVID? And that's just a little bit of my 2 cents. And I'll just let you guys continuously going on, and then I'll just chime in when it seems appropriate.
Yes, Senator, I think it's a great segue. Great segue, the Senate delegation and the reps and representatives, which we do appreciate everybody being here. And Commissioner, thank you so much for your.
May I be excused?
You are absolutely, of course, Commissioner.
Can I just can I interject for a second just before
Senator Lesser.
Colin Harris leaves?
Go ahead.
I just want to state for the record, while she's still here, this has been an incredibly hard situation, and I really want to thank the city of Springfield, and in particular the Department of Health and Human Services, because you're doing an exceptional job. I mean, we got a lot of feedback from constituents who called our office after calling Elder Affairs and the libraries. It was a very confusing situation, and the state needs to own that, because this was a state rollout. And so I just want to publicly acknowledge Commissioner Colin Harris and the mayor and everyone on this call. The city really stepped up in a very big way, and those numbers speak for themselves. All of the appointments that frankly would not have gotten booked without that assistance. So now you can leave, but I just wanted to make sure because it's been a very, very rough situation, and it's the folks on the ground in the community that have been plugging the gap, and we have a lot of work to do to get the state to catch up. But we really need to give credit to the city for stepping up there.
Thank you, Senator Lesser, and thank you for your advocacy as well. It's very much appreciated. So thank you.
Thank you very much, Commissioner. Thank you, Senator Lesser. So as I said, I think this is a good chance to segue. I think we're on the same page, right? We can't have people from the North Shore of Boston get vaccinated at the Eastfield Mall when we have people from the North End that can't get over there, right? So that's the pathway of equity we're headed down. So I think Senator Lesser and Senator Gomez, you've sort of given us some introductions. I'd ask perhaps Rep. Ash and anybody else who just wanted to give us a quick hello before we kind of see if there's questions, or if you'd like to just share with us what you are all working on and how the city council can be supportive. You've heard, obviously, and we're CC'd on the letter that the council sent last week, and it does sound like there's some movement there, but I'm sure there's things going on at the state level that we're not aware of that we would love to be able to support you all on. So, Rep. Ash, if you wanted to perhaps chime in, and then we can just start going.
Sure. Well, thank you. And thank you, Senator Lesser and Senator Gomez, for your comments just then. We've done the same, we've sent out multiple letters, as well as the call, as Senator Gomez mentioned, with Secretary Stutters that we have weekly to get our updates. And one of the questions I had, and I don't know if it's accurate or not because I haven't been up there, but that a lot of these slots are going unused up at the Eastfield Mall. And that was kind of a concern. And I wasn't sure if that's, it was a lack of information that people are getting, or people don't have access to get up there. And that's something that I was going to bring up on our next call. And I had a chance to talk with the secretary or the governor's office. But in that, we've been, working together in the Western Mass delegation like we always do, and trying to make sure that we are getting able, getting Eastfield Mall open, but also our local cities and towns. That I've had a lot of calls from, the emergency personnel just saying that, we're ready to go. We'd like to get enough vaccines so we can start getting them on the towns. And as you know, the sooner we do all that, the quicker our cities, our towns, Western Mass is going to be back up and running. So I just appreciate that, you invited me on here, and the work everybody's doing here to, information obviously is essential for all of us to keep moving forward. But there's one question. I don't know if anybody has that information about the Eastfield Mall and the slots, if they are getting filled up, or if there's some snag here, and if there's something we need to do collectively, or if there's something somebody needs to do to make sure that people are getting access and able to get there.
I think, Representative, some of them have been filled up. Some days are booked. I think some of the later days, there are still several thousand appointments available. That wasn't the case last week. The first week it was booked immediately within hours. Okay. And then when the last round got added on Thursday, there's some open. And I think that really highlights exactly what we, were discussing before, right? Which is, those are vaccines that could be being distributed in our neighborhoods to residents. Right. Springfield, or in other communities, right? That might have access as well. We want them for Springfield, obviously. Representative Gonzalez, I see, has joined us. Rep. Gonzalez, did you want to just open up here and share what your office is working on? We've been discussing primarily up to this point. We've been discussing the letter that was sent by the City Council to the state administration, CCing all of your offices relative to trying to understand when vaccine will be present in the city of Springfield for Springfield residents at distribution points. So, Rep. Gonzalez, thank you so much for this.
Thank you, Councilor. Letterman, thank you, and to Helen Carlson and to Senator Lesser's point. The Department of Public Health for the City of Springfield has done an outstanding job. Again, we've been fielding, like everybody else, the calls, the complaints. I personally went up there directly. In fact, one of the gentlemen that was working there at the site was a good friend of mine, and he was let go because he was trying to deal with 900 people. Only one person was hired for out control, and they let go because of the complaints that officials like yourself, myself, and everybody else was complaining about the lack of the ability to control the crowd, but also keeping people outside. Some people were going on buses, and then they were being told they had to stay outside. No signage. I spoke to the gentleman in charge, the regional manager, directly. I took my personal pictures. Again, me, like I do the work. I don't go to the press. I don't send out letters. I send out letters, but I don't send them to the press. You have a strong delegation here. We've been advocatively working together, as Representative Ash said, and we will continue to do those efforts because we know that the Black and Brown communities, most importantly, have not been vaccinated, not only in the city of Springfield, but the state of Massachusetts, and that being a regional location for vaccination, we know that doesn't work when it comes to health equities and dealing with addressing health disparities, but more so the testing and the vaccination. They haven't worked. So we've been working in the Black and Latino caucus with the administration. We haven't stopped doing that. We will continue to do those efforts. I would just say, as we work collectively, that you have a strong delegation in the city of Springfield, the leadership of Mayor Sarno, who has been addressing this issue from the Baker administration, that send those letters directly to us, and we'll be the letters that we have to send to the Baker administration and to Sutter's office, because I think issues that you guys are the same issues we're working on. The only thing is we don't send them to the press. And, again, I went there, I took pictures, I took that, I didn't send it to the press. And then I just want to make sure that we're all working on the same goal, we're working on the same issue, and there's no delegation stronger than Western Mass delegation. And I think that you guys are doing a fabulous job in addressing those issues. Address them directly to your delegation, and we can get them more so directly to the administration. What we're to do is together in collaboration, is not with the finger, get solutions, because I think an ultimate goal is to get patients to the arms of the individuals and residents of the city of Springfield. And that's my main goal. And I know that's the goal of many of our residents in Western Mass and the delegation of Western Mass. So again, thank you for your hosting this meeting. Thank you for advocating for residents of Springfield. And again, my office is always available directly for you and any other counselor or the city of Springfield to make sure that your voices are heard, because again, many of the time you guys have brought out issues. We are already addressing those issues. So thank you. I'll take any questions that you have.
Thank you, Rep. So we do have a few counselors on the call. Again, we've heard from Senator Lesser, Senator Gomez, Rep. Gonzalez, Rep. Ash. We do have representatives present from Rep. Finn's office, as well as we had Rep. Oliveira on here. I'm not sure if Rep. Oliveira is still with us, but Representative Oliveira, if you are, we'd invite you to share any thoughts that you have. But until we see Rep. Oliveira hop back on, if there are any questions for our state senators and state representatives, we do have Councilor Victor Davila with a question from Ward 6.
Thank you, Mr. Chairman. Good afternoon to everybody, and my apologies for running a little bit today. And before my question, thank you for the delegation working really hard and trying to solve these problems that are developing with the vaccine distribution. So the way I look at it, this is a simple problem of demand and supply. We have a little demand, only have so much supply of vaccinations. We only have so much power to deliver this vaccination. I'm sure that the people that we're using, or the state rather, that is using Cure, doing their very best to get people vaccinated. Nevertheless, problems are happening. And this might have been the cause, so if it did, my apologies. I just saw on the news that the National Guard is being deployed. They are going to be, if I read the news correctly, only patrolling for safety purposes, the parking lot. So my question to the state delegation is, one, why can't we activate the medical corps from the National Guard to help process these vaccinations quicker, and even perhaps open up another site in Springfield, which I have not heard anything as of yet, where the second site is going to be located.
Working on that right now. We're working with
please, yeah.
No, so just to answer your question, Counselor, from what I understand, what's being activated actually is the medical unit. It's not a public safety standpoint. It's going to be the National Guard on the medical side. And I had pressed the microphone. You had heard Rep. Gonzalez had spoken, was talking. He said that we are working with Secretary Sutters on opening up more vaccination sites while the phases are rolled out. We understand.
And a mobile site.
And mobile sites as well. So I know that as of right now in Springfield, the places where vaccinations are being given, obviously we know the Eastfield Mall. We have Mercy Medical Center. Then in West Springfield, we have Stop and Shop in West location in Feeding Hills. And what I can do is I can share with the chairman the email that I received today, so then we can absolutely put the vaccination sites that we have open now in our region outside of Walgreens and CVS, even though it's not adequate and enough of those different locations that are going to be open next week into our next phase that's going to be rolling out for 65 over Crestwood.
Is Mercy vaccinating their population, or is it open to the public?
General population is phase 3, and we're still, I think, in phase 2. Is going to be 65 and over now, if I'm correct.
Well, but I just wondering, you mentioned Mercy. Is Mercy, who are they vaccinating right now?
Anybody that has a vaccination is vaccinating in the phases that is being rolled out, phase 1 and then phase 2. The only heard stories of folks that don't really fall into the phases. Mm-hmm. It's because sometimes people don't make the appointments and they don't want to waste the vaccine and get rid of it. So some folks that happen to be, you hear about it if they're at different locations, and they'll offer the vaccine to a person, right, so that the vaccine doesn't get destroyed and is actually utilized. But only folks that fall into those phases should be the only ones receiving those vaccines.
Thank you, Senator Gomez. And just to make a comment, Mr. Chairman, to finish off, I will strongly suggest that we need a representative on the vaccination group, advisory group of the state. As of yet, we don't have anybody. We need somebody in that group pronto. Again, just to put that out there again. Thank you. Thank you, Mr. Chairman.
Thank you, Councilor Davila. You've been steadfast on that recommendation, and I know everybody stands behind you relative to a Springfield area represented on the governor's vaccine task force. I don't see hands in the queue. Any of the councilors have a question for the senator with us today, or if any of the state delegation have anything else they'd like to share, we'd invite you just to raise your hand or just pop on. Seeing none, I did have one question. I think Rep. Gonzalez might have mentioned the possibility of mobile units, and I know there was some legislation filed around that. Rep, do you want to expand on that, or do we know what it might look like in the future? Or any of the delegation?
I think that's a good issue because there are people who are kind of immobilized in their home who can't figure out how they're going to ever get to a vaccine point. So is there somebody working on that?
Can you repeat that question, Counselor? I apologize.
Yeah,
Sure,
well, there
sure.
was an email I received yesterday from someone who identified himself as handicapped, probably in his 60s or so, and he's got a 94-year-old mother who is handicapped, and he just can't figure out how they're ever going to get to a vaccine point if they get an appointment. So, you know, the solution for them would be somebody brings a vaccine to their house, and is that being worked on, that type of thing?
I think that's an amazing question, and I'm actually going to take that back when I have my update call with the state Senate. I think that is truly evident. I think that's why they're working in like kind of the mobile conversation.
Yeah.
I don't know exactly where down the line that's being worked out in, but I believe that if you can reach out to me and give me that information, we can find a solution. But I understand that administration was doing something with the senior centers. I want to talk out of respect to have all the information specific to we get these vaccinations to elderly that are home. But that is a really good question, and I give you my word that's definitely I'm gonna jump that.
Right, so I'll call your office tomorrow then, Adam. Thank you. Yeah, I've been to the senior centers. I've been to the senior center in Springfield, the Raymond Jordan Senior Center, and they're working. They're a call center now. Basically, they are, and they're making appointments for people. So I don't know if it's going fast enough or whatever, but that part of the operation, at least it's going. And the senior center, the library people are supporting them. So that appointment making thing will still be a frustration, but there seems to be a little bit of a system to it. The transportation part and the mobile part, I don't see a system there yet. So that would be a great issue for you to work on if you could.
So
the other thing I would just like to mention while I have the floor here for a second is, so Representative Gonzalez, you just said, you know, we should be working together and you know, some people are already working on things that other people didn't know about, et cetera. So should we establish for 5 minutes in this meeting or 10 minutes and say, what is our goal for the next week? You know, because there's so many things going on. If this group of people, city and state people together said, here's our goals. And we went for those 3 goals, the mobile thing that I just talked to Adam about, individual vaccine sites in Springfield or whatever.
I'm just putting that. I'm just swinging the computer because we're in the same office. I apologize.
Oh, sure. Yeah. Rep.
I just wanted to say quickly about the local,
Let's just let Rep. Gonzalez and then we'll...
about getting access to people getting the vaccines. I think when we get to having our local communities have more vaccines, or the cities and towns, I think that we're going to be able to, I think it's on Springfield along East Longmeadow, to be able to work with their senior centers or their emergency personnel to be able to get vaccines out to those elderly or disabled people that just aren't able to get to the vaccines.
Rep. Gonzalez, go ahead.
Sorry.
So Alan, absolutely. I think that's the best way to is highlighting our United points and to the forefront when it comes to particularly this issue of how do we address the Springfield residents and more importantly, how does the Baker administration address our concerns, which are unified in the effort of getting vaccinations into Springfield and getting them into more locations and more sites that are more convenient for a high density, low income community that is the city of Springfield.
Thank you, Rep. So we can definitely do that, Rep and Councilor Allen. We usually go to 5:30. It's 5:16. So I think, maybe around 5:23, we'll go into some action items for moving forward. And I will say, I'm going to recognize President Williams with a question. I will say, we do hold this briefing with our commissioner, and we've had different topics. Last week, we met with the federal delegation. We had people working on food security here before. So I do want to just extend this open invitation to any member of the delegation, if you're interested in getting on Tuesdays at 4:30, either to just share an update on what you're working on, or if you're interested in the commissioner is on as well. So certainly you all are in communication with the administration regularly, but if you'd like to join our committee meeting anytime, every Tuesday at 4:30, we have a standing meeting. President Williams?
Thank you, Mr. Chair. My question actually, a couple of representatives actually alluded to the equal access needed in more dense population, especially with Black, brown communities. Question is around supply. So I know, for example, Springfield, with a large city, probably has the capacity to use some of its buildings, schoolings, or otherwise to serve as a location for folks to get vaccinated. And my question is for the supply. Have you heard anything about the coordination, communication around, how many doses Springfield will get, so that the, health department, for example, knows how many sites to open up, for example? Or I'm just wondering, kind of before we get into phase 3, which is of course for the general population, we have to be on our best foot as well. So I was just wondering, is there any conversation currently taking place along those lines?
If you want me to just start on that note, again, our conversations are ongoing about resources and accessibility for the city of Springfield, which is my district, and I'm sure Rep. Ash is doing the same for his district, and all of us are working together on that line. But with the equity issue, obviously Black and brown communities are the less ones that are receiving the vaccinations, and there's a host of reasons why, right? But more so, we are actively pushing for more vaccinations to come to Springfield, and we hope that the city of Springfield, we don't cross lanes when it comes to addressing what's in the best interest of the public health, from the public health standpoint, from the city administrator. But we do advocate for the Black and brown communities to have a allotment set aside to make sure that we can officially and have the ability to vaccinate the individuals in those communities. But it's not going to be done in a way that we can no longer look at accessing or providing health one size, one cent fits all arena. The mobile testing, which I've been asking and advocating since April, I have 2 years to the city of Springfield. I've been advocating for mobile testing, community-based testing, high-density neighborhood testing. That's where our workers live. That's where our low-income workers live, obviously. The same with the vaccinations. I've worked with the Caring Center. We've did some mobile tests in community-based, high-density, low-income residential unit, and they were very effective. We're trying to do the same thing with vaccinations. As far as the allotment coming in, we all have to recognize that it's a new administration. In Washington, D.C., there was supposed to be a full access of vaccinations. That never really was the reality. And I think under the President Biden, they're trying to replenish those resources, get them out to the state, and the state get them.
Representative Gonzalez, I think you were muted there at the end.
Out to the appropriate, and I think that Biden administration was that. Did you hear that? I think they're trying to replenish the supply to get them down to the states, and the state get them to the appropriate municipalities. Springfield being one of those key locations where COVID had, in this county, COVID has hit us pretty bad. Again, I lost a lot of family members and personal friends due to COVID, and we're going to continue to fight on behalf of the residents of Springfield to make sure that we get the appropriate dosages of vaccinations, but not only to these one-stand centers, but also to the high-density, low-income community neighborhoods.
Thank you, Rep. And I would just also, just on the lines around, the press and all that, just finish with saying that, I would just hope that door opens. I mean, it works both ways, right? So sometimes when we feel the need to call for issues, it's just because we know that it's currently taking place. But that information is being communicated to the local delegation in the form of counselors. I think that would be helpful to as well.
Yeah, and I agree, and I think that's the best way to do. I mean, I many letters to the governor. I've written many letters to the mayor. I've never sent them to the press because my goal is to get the job done, not to get so-called information out there to the press that alarms the community. But again, I think it's dual. I think we can open these lines of communication and work for the city of residents, particularly again, in this issue, the health equity issue is key. Because it's key. It's 50% population like in the city of Springfield, and there's no better advocate than the folks that we have in your delegation and city council, as far as the delegation that we have now that's advocating for those individuals, and particularly in our school system, 80% are Latino. We're going to advocate for them. We are actively advocating for them. And again, please, I'm available, willing to communicate. I'm just not one. Again, I went up to the center. I saw the disaster that was up there. Personal friend of mine was there. I spoke to the police officer. I spoke to the director. I started calling the appropriate parties. I don't have time to call the press. That's my situation when it comes to those things.
Thank you. Thank you, President Williams. Are there any further questions for the state delegation? And then we'll jump over to
Mr. Chairman, I just want to give a little bit more information and context to President Williams. I apologize. In communicating with can you hear me?
Yes, go ahead.
So the information that I have is that we want to, from what I understand, they want to expand vaccination centers. But realistically, in 1 week, the federal government is just releasing to 100 doses a week. So in respect to having to split those in half or first doses and second dosages, I think what the representative alluded to, obviously we'll hope the Biden administration starts releasing, or the federal government starts releasing more dosages. The only thing that Massachusetts is relatively looking to receive on a weekly basis is around the number of 100,000 doses. So, so from what we know, with 100,000 doses, how do we spread them around if it's not enough to go around? To be totally just frank about that. And that's one thing that I was talking to the Western Mass director about the early morning phone call that I had with him. So I forgot to give you a little bit of that information. I think that's what's that a lot of the vaccine that is being used by the state to be able to administer and put out into the community. So I just wanted to give you that little bit of information that I thought that was would add a little bit more to the conversation.
Thank you.
And I think, Senator, and for the entire delegation, I think that the biggest question, right, is I think everybody recognizes there's a supply and demand issue, and no one's assigning blame to anybody relative to that. I think we all know that there was a previous federal administration that certainly did not handle this pandemic or the planned response and recovery in a way that we would view as adequate. And I think we know there is a new administration that we hope will be able to respond in a little bit more of a methodical and appropriate manner. So I think the question is that folks really want to know is we understand the doses are not there right now to do that type of broad-based approach, but when do we anticipate the doses being there? And once they are there, what do we anticipate? And if the answer is we don't know because the federal government hasn't informed us well enough, then we all get together and we go and see the congressman. So I know you all know, I think that's the big question, relative to just trying to plan for the future. I think I've seen strong statements and legislation introduced by all of you relative to the state response. And so I think it's just, us bringing the perspective from the local side and having these conversations with our commissioner and hearing from her, what her challenges might be. So I know we have just a couple of minutes left, so I do want to just invite any other counselors with any questions. And then we mentioned the possibility of just leaving with a couple action items. Senator Lesser, I know you were with us in the beginning. I think I still see you there if you wanted to share anything in closing before we sign off on a couple action items, or Rep Ash or anybody else. No. All right. So I think the three biggest things I heard, and for staff as well, we appreciate you joining the call on behalf of your delegation members. I think the three main things I heard, and maybe counselors can chime in, were the information around when we anticipate vaccines coming in at a level that they can be distributed to cities and towns. I did see West Springfield announce they were getting 100 a week, so I don't know when we'll hear that announcement for Springfield as to what that will look like. I think number two is the mobile vaccination piece, and when we can expect to see a mobile vaccination unit of sorts. And I would personally say number three should be what Councilor Davila brought up, which is a Springfield area representative on the governor's task force. I know the Councilor Davila spearheaded some communication around that earlier in the year. We know, I think there's somebody from up around Greenfield, but nobody from Hampden County. So if anybody had anything to add, other than that, I think we'd be ready to move towards the conclusion. All right, seeing none. Thank you all so much for joining us. We're in 5:30, and so appreciate it. We will be meeting next week at the same time, Tuesday at 4:30 p.m. Again, for our delegation, it's a standing invitation. Always welcome to join us. We appreciate all the work you're doing on Beacon Hill on behalf of the city of Springfield. And next week, we expect to have a couple of guests, so I'll have the staff send out the agenda. And again, we also are waiting on a date from the governor's office and DPH as well. Thank you all so much, and we'll adjourn the meeting at this time.